Hi everybody, it's Honest John. Kleptomania is an inability to resist the urge to steal. Kleptomaniacs do not steal out of greed. They don't plan their theft. They steal on impulse, and often the items that they steal have little or no value. They describe a feeling of pressure that lets up when they steal. And kleptomania is associated with a variety of other mental disorders, including anxiety disorder, drug abuse, even eating disorders, which presents a little irony here, because kleptomaniacs with an eating disorder might steal food but not to eat it. And that's the big difference, again, between a thief and a kleptomaniac. A thief plans his thefts, and what he steals is something that is either useful or valuable. A klepto steals on impulse. They describe a feeling of pressure that eases up after they steal. And what they steal may have little or no value to them. Some clinicians believe that kleptomania is merely a form of obsessive compulsive disorder. And there's a great deal of argument about what kleptomania is. There's no agreement on what causes it, what its roots are. And so it is treated with a variety of different therapies depending on what the therapist feels they're actually treating. So approaches include individual and group therapy, various behavioral therapies, including aversion therapy, which attempts to pair unpleasant stimuli with the urge to steal. And it's also treated with anti-anxiety medication. In a hospital setting, staff should be firm but not judgmental. You don't judge the patient. You understand that this is not a moral failing, it's an illness. Staff also has to be very alert, because you want to prevent thefts, and you also want to make sure that when something is stolen, it gets returned as quickly as possible, because you're dealing with a whole bunch of other patients who can become very upset and angry if their stuff turns up missing. Now, this is the last video that I'm planning to make in this mental illness series. However, the DSM-3, which lists the psychiatric and medical disorders, is a very big book. So if any of you have any questions or disorders that you would like me to research and do a video on, I'll be happy to do it. Just let me know. Thanks for listening.